Hello, my geniuses. Welcome to another physiology lecture series. Today is a great science tolerance. And today we'll be talking about fetal circulation. So we have talked about the coronary circulation. We have talked about cerebral circulation. So we'll be doing the fetal circulation. We call them the regional circulation. You get it now. So it's very, very important you understand this, because if you are talking about how the baby receive blood during pregnancy and what is the communication between the mother and the baby, because the baby is not producing blood like that. Anything that is being supplied to the baby is coming from the mother, even though the baby is producing all different types of cells and different types of materials or components, but the movement between the mother and the child, the blood movement between the mother and child, is called fetal circulation. Now, it's very, very important to stay to the end of this video, because I'll be giving you useful mnemonics at the end, and also easy ways for you to pass your exams if you stay with me to the end. So it's very, very important you do this. You get it now. So if you are just new to my channel, make sure to subscribe and turn on your post notification button, so at any time I drop any video, be sure to be notified. If you want me to make a video for you, drop it down in the comment section. I promise I'll make that video for you when I say it. So let us jump right into the video. Get it now. So what is fetal circulation? Now, just take a wide guess. What fetal? Fetal means fetus. You get it now. Fetal means fetus, which is a fetus in the womb. That is fetal. Then circulation means movement of blood. You get it now. So the fetal circulation is the movement of blood. Are you getting me now? Between the mother and the child. You get it now. Between the mother and the child, and basically between the child's blood vessel. So again, the movement of blood, or the pattern in which the blood flows between the mother and the child, and also within the child's body, because the child produces blood, but the blood cannot be oxygenated in the child. Why? Because the child's lungs are non-functional. So the child needs the mother to help it to oxygenate the blood in order to take it back to circulating within the body. So the movement of blood within the mother and the child, and within the child itself, which is the fetus, is called the fetal circulation. Why do you need the mother? Because the mother transmits nutrients. The mother transmits what? Oxygenated blood, because the mother helps the child to oxygenate the blood with her lungs and then flow it to the child through the umbilical vessels. You get it now. So that's how it works. Fetal circulation between the mother and the child, and within the child's cardiovascular system. That's what's called fetal circulation. So hope you understand now. So there are three basic physiological shunts that is needed here for fetal circulation to occur well in between the mother and the child, and basically in the child. You need three components. So the first component is the ductus venosum. Are you getting now? So the ductus venosus is very, very important here, because it's present in the child too. Now you have the foramen ovale, which is present in the child too, and you have the Ductus Arteriosus too. It's also present in the child. So you have the Ductus Venosus, you have the Ductus Arteriosus, you have the Foramen Ovale. These are three basic components that are important for physiological shunting, and also for successful cardiovascular communication between the heart, the blood vessels, and other components of the child. So without these structures, circulation of blood will be hard, and the child will just be circulating bad blood. And when the child is circulating bad blood, there could be so many complications. Again now, there could be so many complications that could damage the baby's organ. The baby's organ will not grow well, and when the baby's organ doesn't go well, he might come out with some congenital abnormality. So that's why we need successful fetal circulation between the mother and the child, and within the child's blood vessel. Again now. So now, moving on to the next one now. What are the patterns of fetal circulation? What are the patterns? What will you say is the patterns of fetal circulation, though? How does it occur? So first of all, so oxygenated blood from the mother now. Let us say now the mother is giving the child oxygenated blood. Oxygenated blood are blood that contains oxygen, which means it has been reperfused in the mother's lungs, by the mother's lungs and in the mother's body. So now, oxygenated blood leaves the mother to the placenta, to what we call the umbilical vein. Yeah, now so the umbilical vein is carrying oxygenated blood from the mother to the child in the placenta, because the placenta is just a compartment system that attaches the baby to the mother. You get it now? So that placenta, so it has a mother's part, and it has a baby's part. So we call the fetal part and the maternal part. So go watch my video on the development of the placenta. You get it now? So the mother's part gives oxygenated blood to the fetal part, to the umbilical vein. You get it now? So a small amount enters into the liver. So immediately after the umbilical vein, what happens? The blood goes upwards. So you check it now. Immediately after the umbilical vein, the blood goes upwards, and a small amount passes through the liver. Are you getting me now? So a small amount is passing through the liver to what we call the ductus venosus. So the ductus venosum or the ductus venosus is the one that carries blood from the umbilical vein to the liver. Are you getting me? So immediately it is leaving the mother to the umbilical vein. What happens? That placenta, the umbilical vein moves upward, carrying the blood, passing it through the liver. When it passes through the liver, it enters a structure called the ductus venosum. And this ductus venosum here is very, very important, because some part of the fetal liver collects blood immediately. So some part of the fetal liver immediately collects blood as you see it immediately. So when it collects blood, what happens? A large amount of blood goes upwards to the IVC. So majorly the IVC transmits the oxygenated blood, but in fetus what happens? The IVC is not transmitting the oxygenated blood. It transmits what we call oxygenated blood, because the blood has to do what? Come upwards from the ductus venosum and continue to the what? IVC. Again, so one thing you have to know that is important here is that from the mother to the placenta, from the mother to the placenta, to the child, to the umbilical vein. So the umbilical vein is the only part of the child that carries the oxygenated blood. So when it carries the oxygenated blood to the umbilical vein, it goes upwards, passing through the liver. So the main organ of the child that it passes after the placenta is the liver. And in the liver, you have what we call the ductus venosum. So the ductus venosum carries the blood, and you get him now. And itself to the hepatic artery, they collect blood to feed the liver. Are you getting me now? So they collect blood to feed the liver. So from the ductus venosum, what happens? The blood now goes upwards through the IVC. So from the IVC is connected to the what? Right atrium. So the blood enters into the right atrium immediately. So when it enters into the right atrium, are you getting now? So the right atrium collects the blood using what we call atrial diastole. So the heart will be in atrial diastole that time. So when the right atrium collects the blood, it collects all the blood once. What happens now? It cannot go to the right ventricle, because from the right ventricle it's supposed to go to the lungs, and the lungs is unfunctional. The lungs only contains surfactant. It contains fluid. Why? Because we want the lungs to be developed. We don't want oxygenation cannot occur in the lung, because the lungs is not that rich yet to be what? To be perfusing any blood. So what happens? From the right atrium inside of it to come into the right ventricle, you know what it does? It shunts itself to the what? Right. It shunts itself to the what? Left atrium. So from the right atrium to the left atrium, that's why I call it first shunting. The first shunting here is the ductus venosum, which you have talked about. The ductus venosum connects the umbilical vein to the IVC. So it is shunting to the liver. So it is a bypassing to the liver. That is the ductus venosum. The next one is that when the blood is now in the right atrium, what happens? It shunts itself to the left atrium, to the what? Foramen ovale. So the foramen ovale connects the right atrium to the what? Left atrium. So the foramen ovale is formed by the ostium primum and the ostium secundum. So the ostium primum, ostium secundum forms the foramen ovale. You get it now? So when the blood is shunted from the right atrium to the left atrium, what happens now? From that left atrium, what happens? It goes to the left ventricle. I get him now. From the left atrium, what happens? It goes to the what? Left ventricle. So very, very easy. Very, very easy. It's not really hard like that. From the left atrium, it goes to the what? Left ventricle. And from the left ventricle, using what we call systole, ventricular systole, what happens? The blood is pumped upwards to supply the rest of the what? Body. So that's how it works. You get it now? So from the right atrium to the left atrium, from the left atrium to the left ventricle, and from the left ventricle to the ascending aorta to the rest of the what? Body. You get it now? But any blood, some amount of blood from the right atrium goes to the right ventricle. Always remember, some amount of blood goes from the right atrium to the right ventricle. But you now know what? If they go to the right ventricle, they move to the pulmonary trunk. When they move to the pulmonary trunk, do you know what they do? After they move to the pulmonary trunk, they don't go to the lungs. I get him now. There's a connection between the pulmonary trunk and the aorta. There's a connection between the what? Pulmonary trunk and the what? Aorta. And you know what that causes? We call it the what? Ductus Arteriosus. So the Ductus Arteriosus connects the pulmonary trunk with the what? Aorta. Okay, now so any blood that enters into the right ventricle goes to the pulmonary trunk, because the pulmonary trunk is supposed to take it to the lungs, but they cannot take it to the lungs. Do you know why? Because the lungs is collapsed, the lungs is unfunctional, the lungs is still building itself. So what happens? It shunts it into the what? Aorta, to what we call the ductus arteriosus. While some that enters into the left atrium down to the what? Left ventricle, and uses what we call the ventricular systole to push the blood through the ascending aorta to the arc of the aorta to the rest of the body. Again, so that is how it what works. So blood is supplied, oxygenated blood is supplied to the all part of the body. So when the body uses up the oxygen and uses up the nutrients, what happens? It goes back to the mother, to what we call the umbilical arteries. So the umbilical arteries in this case is taking the oxygenated blood to the placenta to the mother, while umbilical vein takes what? Oxygenated blood from the mother to the baby. You get it now? So now, instead of arteries to carry oxygenated blood in the baby, the umbilical arteries is carrying deoxygenated blood, while the umbilical vein is taking what? Oxygenated blood. So you can see it now. It's very, very easy. You get it? So now, what is the function of the physiological shunt? I have told you, the ductus venosium, it connects the umbilical vein to the IVC. You get it now? It connects the umbilical vein to the IVC. So what does it do? It bypasses the liver. So the ductus venosus just bypass the liver, connecting the umbilical vein to the IVC. But remember, when it bypasses the liver, some part of the liver takes blood down to supply the liver itself. So it carries rich oxygenated blood. And that rich oxygenated blood, remember, the oxygenated blood at this particular point is about 97%. I get it's about 97%. Now, what is the foramen ovale? The foramen ovale, I told you, it connects the right atrium to the left atrium, which is the ostium primum and ostium secundum. What happens is shunt blood between the right atrium to the right ventricle, so that it can continue for systemic what? Circulation instead of pulmonary what? Circulation. So it's very, very important. So it also carries oxygenated blood, but the oxygenated blood now have dropped to about 85%. But the ductus arteriosus, what happens? The ductus arteriosus connect the pulmonary trunk to the aorta. You get it now? So in case blood goes to the right ventricle, and from the right ventricle is supposed to go to the pulmonary trunk down to the what? Lungs. But there's no lungs here. What happens? When it gets, due to the pressure in the pulmonary trunk is low, what happens? It shunts it into the what? Aorta, to the ductus arteriosus. So what are the changes that occurs here? What are the changes that occurs at birth? So what happens if the child takes his first breath? Maybe he cries. If the child takes his first breath, he cries, and what happens? He vomits. Sometimes he coughs out all those surfactants. When he coughs out all those surfactants, what happens? The pressure, are you getting me now? The pressure in the pulmonary trunk will reduce. There's what we call the pulmonary vascular resistance will what? Reduce. So the pulmonary vascular resistance will reduce, which means blood can be shunted now to the lungs. So the lungs have expanded. The surfactants, some of them are drained into the lymphatic circulation or into the venous circulation. Why? What happens now? And the baby cough out some of them. Then what happens? The pulmonary vascular resistance reduce. And what happens now? The lungs from the right ventricle, it can move to the pulmonary artery down to the lungs. So there's a reduction in pulmonary vascular resistance. So what happens? Clamping up the umbilical cord. Now if you clamp up the umbilical cord, what happens? Blood supply to the placenta will go. The 3 stages of labor is what? Dilation of the cervix, delivery of the baby, and what? Delivery of the placenta. And before they deliver the placenta, they have to clamp the umbilical cord. And if they clamp the umbilical cord, what happens? The placenta will not see blood and it will start dying. So one, there will be the reduction in pulmonary vascular resistance. Clamping the umbilical cord reduce placenta blood flow. What happens? Due to the high increase in pressure in the right atrium, are you getting me now? What happens? The foramen ovale will close. Are you getting me now? The foramen ovale will close due to a high pressure in the right atrium. What happens? The foramen ovale will close, and also the pressure also in the left atrium. The pressure in the left atrium will also be high because blood is not coming from the lungs into the left atrium. So this pressure that is taken in the left atrium, what happens? We push the interarterial septum together, closing them. When it closes, then what happens? If that foramen ovale becomes what we call Physalis ovalis. So we'll talk about it too. So the next one here is that increase in oxygen tension constricts the ductus arteriosus. So the ductus arteriosus is supposed to shunt blood from the pulmonary trunk to the aorta due to the fact that the pulmonary trunk is supposed to take it to the lungs, but it can't take it to the lungs. So what does it do now? It helps in shunting it to the other side so that circulation can continue. So due to high pressure, what happens? There will be constriction of the ductus arteriosus. Again now, and when there's constriction of ductus arteriosus, it forms it obliterates and becomes another ligament called the ligamentum arteriosus. But sometimes if it cannot constrict, what happens? They will have to give the baby what we call indomedicine. So indomedicine will force the ductus arteriosus to close. If not, there will be what we call patent ductus arteriosus, which will cause what we call continuous murmur. So the ductus venosus too will also close because the pressure is normal. The placenta blood flow is now low. The placenta is normal collecting or receiving blood. The placenta is dying off. What happens? The ductus venosus will close. Why? Because the placenta is no more receiving blood. And if the placenta is not receiving blood, which means blood through the umbilical vessels are now low, and since blood in the umbilical vessels are low, what happens? The ductus venosus is no more in use. So what happens? It will become obliterated. So naturally it's between the mother and the child, but now after the baby has been given birth, what happened? The baby can survive on its own and there is no placenta again, so which means there's no blood through the pulmonary vessel, and if there's no blood through the it means there's no blood through the umbilical vessel, and if there's no blood through the umbilical vessel, what will happen? The ductus venosus will close again, so there will be obliteration of the ductus venosus. And if there's obliteration of the ductus venosus, it becomes what we call the ligamentum venosum. The next one is adult remnant. What is the adult remnant? This physiological shunt now, when they become obliterated after the baby has taken in air, they become obliterated. What happens now? They don't need all the structure again, so they will now become fibrous and forms a true ligament. I guess not a false ligament. They'll form a true ligament and just be there. So if the ductus venosus closes due to reduction in placenta blood flow, what happens? It forms what we call ligamentum venosus. If the foramen ovale closes due to high pressure in the left atrium, what happens? It will cause what we call Physalis ovalis. If the ductus arteriosus closed, which is between the pulmonary trunk and the aorta, what happens? It will cause what we call ligamentum arteriosum. If the umbilical vein reduces due to, remember, umbilical vein carries oxygenated blood from the mother to the placenta. So if the umbilical vein also becomes obliterated, it will form ligamentum teres hepatis, which is usually seen in the liver. If the umbilical arteries becomes obliterated, because the umbilical arteries takes the deoxygenated blood back to the heart. So if it's taking the deoxygenated blood back to the heart, what happens? It becomes obliterated because there's no more blood that is going there again. The mother's connection is out, so the child has to develop his own venous system that will be taking blood to the heart for oxygenation again. You get it now? So if you obliterate, it's from what we call medial umbilical ligament. So what are the important clinical notes here? Number one, patent ductus arteriosus PDA. Now what is patent ductus arteriosus? This is when there's failure of obliteration of the ductus arteriosus. So if it fails to close, what happens? Any blood, now the baby is fine now, any blood that goes to the pulmonary trunk, some of them will go to the lungs, while some of them will be shunted into the aorta. And when they are shunted into the aorta, what happens? It will cause what we call continuous murmur. So there will be continuous murmur due to this patent ductus arteriosus. So if you auscultate the patient, the murmur will be here and it will be like a truck moving. Patent for foramen ovale. This is when the interarterial septum doesn't close, which means there will be what we call physiological shunting, or even pathological shunting, not physiological, because at first it was physiological shunting, now it's pathological shunting. The baby will be circulating deoxygenated blood, causing the baby should be blue. The baby will now be cyanotic, and it's very, very bad. So it can be treated with surgery. congenital heart defect. So it could cause any congenital heart defect. Are you getting me now? Because now the baby should be able to circulate blood, and due to maybe the one or two of the structural part of the baby is not formed very well, the baby will not be oxygenating blood in the lungs. Therefore, various issues can occur. There could be transposition of the great vessel due to the damage of any part of the heart. You get now. There could be tetralogy of the fallow, which is due to anything. There could be any congenital heart defect due to low amount of blood that is supplying the heart. So the heart muscles will not develop and they can cause anything. I hope it all made sense to you and you have understood everything we have talked about. So the placenta is the functional lungs of the fetus. Remember, because the fetal lung is not functional. So the placenta has to reperfuse the blood between the mother and the child. It helps the child to circulate good blood. There are three shunts, which is the Ductus Arteriosus, the Ductus Venosus, and the Foramen Ovale. So all these are very, very important here because at birth this shunt is closed and the fetal circulation is transformed into adult circulation, so that the baby can now do everything by its own. If not, there will be cyanosis and the baby might die due to the reduction in oxygen, or there could be an oxy brain injury, or there could be cerebral palsy due to some part of the brain are not receiving blood. There could be cerebral issue, congenital cerebral issue, which could damage the baby and transform the baby from normal to abnormal. So hope you have understood everything here. Please, if you are just joining me, make sure to subscribe and share this video to every of your classmates and other people that are preparing for every exam. It is fully detailed and I explain everything step by step. So I'll be seeing my next video. Bye bye.